providing timely, relevant content to providers who care for children. Welcome to Pediatrics in Practice, presented by Children's Mercy Kansas City. Here's Dr. Michael Smith.
I'm Dr. Mike. This is Pediatrics in Practice. The topic is the importance of fast action for infant and pediatric stroke. My guest is Dr. Mukta Sharma. Dr. Sharma is a co-leader for the Comprehensive Pediatric Stroke Center and Services at Children's Mercy Kansas City and assistant professor of pediatrics at the University of Missouri, Kansas City. Dr. Sharma, welcome to the show.
Thank you so much, Mike, for having me today.
Let's start off. How common is stroke in newborns?
Stroke in children and newborns is uncommon but not as rare as once thought. Risk of stroke, I would say for live births is about 1 in 4,000. And for older children, about 10 out of 100,000 children per year get stroke. So to compare it, I think a common pediatric condition people are aware of is brain tumors as one of the most common cancer in children. So stroke in children is as common as brain tumors in children.
Yeah, so you said something interesting. You said that it's more common than what we originally thought. So in the past, were doctors just misdiagnosing stroke in infants? Yes.
So both. So stroke overall, the incidence in children has what we call a bimodal curve. So highest incidence of stroke in children is actually infants and children. So what we call perinatal stroke around birth up to age of 1 month. And I think over the last decade, a lot of numbers that we are hearing about how common stroke is coming from raised awareness and increased ability to diagnose based on technology and neuroimaging modalities that have become available. So I think that's leading to recognition that stroke is much more common than we thought previously.
And so what are some of the more common causes of stroke in a newborn?
As far as when we talk about stroke, and again, when we say newborns, I'm going to refer to both newborn children and because causes for stroke are different around perinatal period or newborn babies compared to older children. So for now, what's available in research, for a large part, we do not know why stroke happens in newborn babies or in the perinatal period. There are various mechanisms that have been proposed, including traveling of a clot from placenta to fetal circulation and the clot traveling to the brain. And so this can happen before delivery period or right around the time of birth. And babies can present with symptoms like seizures, poor feeding, respiratory issues. So the symptoms can be non-specific compared to stroke symptoms we see in children and adults, where commonly presenting symptoms can include what's called in the FAST criteria. For example, the facial drooping, the arm weakness, slurring of speech. So compared to that, newborn babies, their symptoms can be non-specific when we talk about symptoms of stroke in neonates or babies compared to older children and adults.
Right. Which of course makes it tough to diagnose, but we are recognizing it better now. Is that really what's happened? Is we're recognizing these warning signs, and we're able to then implement an action plan faster? Is that why maybe we're diagnosing it more? We're seeing the numbers go up, but we're addressing it quicker.
That's correct. So, based on American Stroke Association's guidelines for managing stroke in children, hard to prevent because we don't know a lot as to why stroke happens in babies, but the focus is based on promptly recognizing and diagnosing the stroke so that we can take steps to reduce the odds of stroke recurrence and helping children as they go through their different development phases to be able to recover and be able to regain potential to the fullest possibility.
So I know that Children's Mercy is one of maybe 10 or so national centers with a pediatric stroke clinic. So tell us a little bit about the stroke clinic at Children's Mercy.
It is a new development, and we're kind of a newborn baby on the horizon as far as stroke program goes. So there has been a lot of background work that's been hospital-wide and involving a lot of subspecialist supports and other services. So emergency department, our transport service, our intensive care services involving neuroradiology services, and of course, hematology in terms of management of clots and bleeding problems. Our stroke neurologist, Dr. Khalid, Ruha Khalid, and our rehab team. So it really is feels like it has been mobilizing a village to line up services here at Children's Mercy to be able to care for children with stroke. So we are very excited to have started our multidisciplinary stroke clinic. We had our first clinic in September, and it was just overwhelming to see response of families where in one afternoon they could see all these different subspecialists, get therapy evaluation for their children all under one roof, one umbrella, and all subspecialists in the same room. So I've been thrilled for all the background work that has happened, and now our clinic has started here at Children's Mercy.
So that's interesting, right? So when a patient comes to the clinic with the family, they stay in one room, and so the idea is you guys come, to the patient, to that room, and they can see everybody at once, right? That's kind of how it works.
Yes, that's correct. So our comprehensive team in our clinic includes myself and Dr. Khalid, our stroke neurologist. So we tag team to see patients together, and then it's followed by our rehab team, which is Dr. Vedivalu, accompanied by a neuropsychologist and OT and PT therapists. So it's really a variety of specialists these children are able to see in one visit compared to going to different clinics throughout the hospital.
How are patients referred to the clinic?
A lot of referral are at this point coming from within our hospital, and that is because when stroke happens, children are presenting to the emergency department, or it's being diagnosed in the nursery or neonatal ICU we have at the hospital. So at the time of discharge, based on children that have complex needs, and it is important to know that almost 4 out of 5 children can have long-term, lifelong deficits from stroke, from the injury they have. So every minute of stroke, about 2 million neurons or brain cells are being damaged, and we know the brain cells do not regrow. So really the goal is towards limiting injury. So for patients that are more complex and need to see different subspecialists, they are the ones that are referred to our stroke clinic. For some children that have had the workup done, so we were talking earlier about risk factors for stroke in children, and some of them include congenital heart disease, abnormalities with the blood cells, sickle cell disease. So there are conditions we know that increase risk of stroke in children. So based on what their underlying need is and need to see different subspecialists, that's how they're referred to the stroke clinic. Otherwise, for example, their therapy needs are more frequent, they will go and see the rehab team on more frequent basis and then come back to the comprehensive clinic to have a visit with all the providers.
Okay. And so with this comprehensive approach, with the early intervention, the rehabilitation that occurs, what kind of outcomes are you experiencing with these patients?
We have known that brains in children have higher neuroplasticity and have ability to recover and develop new learning pathways. And I think the earlier we intervene, the better outcomes we see. And over the years, having taken care of kids with stroke, it is amazing to me that as we have lined up services for early recognition, early referral to services, I have seen children, so for example, babies with newborn stroke, like we had talked about earlier, their symptoms can be nonspecific, and they're really not presenting with weakness per se around birth time, but they will develop that. They'll develop neglect of one side, losing of developmental milestones, and these will typically present between 8 months to 12 months of age. So there's that big gap. These babies then go home, and then they're developing those symptoms of weakness. And we are seeing again and again in our clinic and in our experience that the earlier these babies are diagnosed around birth time and referred to therapy, better outcomes they have. And really, we do not know, even with the same pattern of brain injury, lack of blood flow either from a clot or a bleed, the lesions or brain lesions may look similar on MRI scans or on neuroimaging, but the symptoms can be so different, can be from mild to very severe for a similar looking injury, and we do not know why. But what we're experiencing is starting them early in therapy really helps change their long-term outcome in terms of better outcomes with earlier
So that's the key, right? Early intervention, right? And that's exactly what you guys are able to do. I know you're teaching that out to the community physicians as well to recognize those warning signs. So, Dr. Sharma, thank you for the work that you're doing at Children's Mercy, and thank you for coming on the show today. You're listening to Pediatrics in Practice with Children's Mercy Kansas City. For more information, you go to childrensmercy.org. That's childrensmercy.org. I'm Dr. Mike Smith. Thanks for listening.